appearing on your screen right now, let's describe this. This would be the uterine cavity over here. This is the lining of the endometrium. And this is the inside of the endometrium right here. And this is a pregnant one too. There'd be quite a bit more over here, like myometrium and all that, but this is the endometrium here. And this structure, as it says, implanted blastocyst, and the blastocyst would also include some of the structures out here. It started by sticking to the lining and then eating its way in, digesting its way in, and the endometrium closes behind it, like closing a door behind it as it comes in. We've already started developing an embryo right here. The inner cell mass is no longer just the inner cell mass in this picture. We do have an embryo forming. You can see some of the germ layers or, embryonic layers already. This blue thing you see right here, that will eventually surround this embryo fetus and become something I think you may have heard about. Again, we're getting into terms and areas that are not on the final, but I thought it would be nice to at least discuss this. Something called an amnion. That's the membrane that encloses that fetus and it floats in the amniotic fluid within the uterus. When they do a procedure called an amniocentesis, where they go in and take some cells out of there to check them, they're checking that fluid. So when we're a fetus in our mom's uterus, we're floating in a fluid, and that's the amniotic fluid. And this will form that amnion right here. This is what they call the yolk sac here, which will come Now the outer part of that embryo, if you want to call it, it's not really this here, but the outer part of the blastocyst is called the chorion. And what it's doing early on is secreting something we talked about the other day. What's the significance of this hormone here?
Growing.
Human? Of course it's human. As opposed to it's chimp or whatever. But it's a human chorionic gonadotropin, HCG. And this stuff is secreted into the blood, and it is responsible for maintaining, at least for a time during pregnancy, maintaining the corpus luteum, which is back in the ovary. Now think about what we were saying Tuesday. We said that luteinizing hormone develops the corpus luteum, and maintains it for time. And if we're not pregnant, of course, the LH being inhibited, corpus luteum then will atrophy and become a corpus albicans. Progesterone levels, estrogens will drop off, and we'll have, after that, what will occur? Did that give you a hint? Menstruation. We can't have menstruation here when we're pregnant. We must maintain that corpus luteum for a time. LH can't do it because it's going to be inhibited by the very levels of the steroids, the progesterone particularly, that's being secreted. And so what takes over, as I said before, and mimics or acts like luteinizing hormone is now coming from the chorion of this little blastocyst itself, as you want to call it, an embryo. Kind of incorrect, but you can call it one. So this takes the place of LH. It's mimics it or takes the place of it.